You wake with a deep cut across your foot. There is no hospital, no pharmacy, no clean bandage waiting in a plastic wrapper. By sunset, you still have to move. For most of human history, pain was not an interruption to life. It arrived inside life, and your ancestors had to survive both the injury and the message screaming through their bodies. That sounds like proof that ancient humans were simply tougher than you. Maybe their nerves were duller. Maybe they could grit their teeth and ignore what would send you searching for an emergency room. But that is probably the wrong picture. Ancient humans did not necessarily feel less pain. They became unusually good at surviving while pain was present. That difference changes everything. Pain is not a simple meter of physical damage. Your brain builds the experience from signals arriving through the body, then adjusts it according to danger, attention, memory, expectation, and whether help feels close. A small injury can feel enormous when you are frightened and alone. A serious injury can briefly fade when escape becomes more urgent. You have felt this system working. A bruise starts throbbing only after the stressful moment ends. A cut becomes sharper the instant you look at it. Why would your brain wait? Because pain is an alarm, not a photograph. Its purpose is to change your behavior. Protect the ankle, stop using the hand, avoid the fire, stay still long enough to heal. Your ancestors carried essentially the same kind of warning system, but they lived in conditions that gave pain a very different meaning. There was no expectation that every ache could disappear immediately. There was no bright line between being injured and continuing the day. Pain often had to be managed while food was gathered, children were watched, shelter was repaired, and predators remained nearby. That did not make suffering harmless. It made coping a survival skill. The evidence begins in damaged bones. At Shanidar Cave in northern Iraq, archaeologists recovered the remains of several Neanderthals who had survived serious injuries. Paleoanthropologist Eric Trinkhaus studied this pattern in detail. One individual, known as Shanidar I, had lived with a crushing injury near the left eye, major damage to the right arm, an abnormal gait, and severe hearing impairment. These were not tiny inconveniences. They would have changed how he walked, worked, hunted, noticed danger, and communicated with others. Yet the injuries showed healing, and he survived into an unusually advanced age for a Neanderthal. How? Not by pretending nothing hurt. Shanidar I almost certainly adjusted his behavior, and the group around him probably adjusted too. Someone with one functional arm cannot perform every task in the usual way. Someone who struggles to hear cannot reliably detect every approaching threat. Survival becomes a shared calculation. This is where the image of the solitary, unbreakable caveman begins to collapse. The strongest ancient response to pain may not have been individual toughness. It may have been other people. Archaeologist Lorna Tilley developed an approach called the bioarchaeology of care. The name sounds technical, but the idea is simple. When a skeleton shows a disabling illness or injury that healed over months or years, researchers work backward and ask what that person would have needed in order to remain alive. Could the individual walk to water? Could the individual chew ordinary food? Could the individual escape danger without assistance? If not, survival may preserve evidence of care even when the caregivers themselves left no written record. A much older clue comes from Dmanisi in Georgia. A skull described by David Lordkipanidze and his colleagues belonged to an early human who had lost nearly every tooth years before death. The bone around the empty sockets had healed, proving this was not damage that happened at the moment of death. The individual lived roughly 1.77 million years ago. Without most teeth, tough raw food would have been difficult to process. Soft foods may have been available naturally, and firm conclusions are impossible. But the survival of this individual suggests access to food that could be eaten despite severe chewing problems. Perhaps others selected it, softened it, or shared it. Whatever the exact answer, helplessness did not always mean abandonment. Now move forward to a cave called Liang Tebo on the island of Borneo. A team led by archaeologist Tim Ryan Maloney studied the skeleton of a young person whose lower left leg had been deliberately removed at least 31,000 years ago. The bone showed organized healing rather than the chaotic damage expected from an animal attack or accident. The person survived for years after the operation. Pause inside that fact. A child loses part of a leg in a tropical environment where infection could turn a small wound deadly. Bleeding has to be controlled. The wound has to be protected. Movement, food, water, and sanitation all become difficult. Yet the child reaches young adulthood. The bones cannot tell you what reduced the pain. They cannot prove which tools, plant preparations, or rituals were used, but they do show that the operation was not the end of the story. Healing required time. Time required support. Support transformed unbearable pain into survivable pain. Your ancestors also learned from plants, although every claim must be handled carefully. At El Sidrón Cave in Spain, Karen Hardy and her colleagues examined hardened dental plaque from Neanderthal teeth. They found traces of plant material including yarrow and chamomile, bitter plants with little obvious food value that have long histories of medicinal use. Later, Laura Werrick and her team studied ancient DNA preserved in Neanderthal dental calculus, which is simply plaque that hardened on the teeth. One individual with a dental abscess carried traces linked to poplar, a plant containing salicylic acid, the chemical family that eventually gave rise to aspirin. Does that prove a Neanderthal medicine cabinet existed? No. It does suggest that ancient humans and their close relatives interacted with biologically active plants and may sometimes have selected them in response to illness or pain. Knowledge did not need to be written in a book. It could live in memory, taste, smell, observation, and repeated experience. A grandmother notices that one bark eases a fever. A hunter remembers which leaf calms an inflamed wound. A child watches, copies, and carries the lesson forward. Pain becomes information shared across generations. Now reconstruct an ordinary disaster. You are crossing uneven ground at dawn. Your foot slips between two stones. Your ankle twists, and a bolt of pain drives you to the ground. There is swelling almost immediately. You cannot scan the joint. You cannot order an X-ray. You do not know whether the bone is cracked or the ligament is torn. What happens next? The group does not ask whether the injury is convenient. Someone takes part of your load. Someone studies the swelling. A straight branch becomes support. A strip of hide limits movement. The day's route changes because your body has changed. You still hurt, but you are not solving the pain alone. At camp, attention moves between the injured ankle and the dangers surrounding it. A fire must be kept alive. Food must be divided. Children need reassurance. Stories and conversation continue after dark. That social world matters more than it seems. Modern experiments show that pain changes when safety changes. In research led by psychologist Naomi Eisenberger, people reported less experimentally induced pain while viewing a photograph of a close partner. The injury signal had not changed, but the brain's interpretation of threat had. A trusted person can function like a safety signal. Your ancestors rarely had access to perfect treatment, but they often had immediate human presence. Touch, familiar voices, shared attention, practical help, and the expectation that the group would respond could all change the experience surrounding an injury. None of this magically erased damaged tissue. It reduced the additional burden of facing danger alone. Ancient humans also moved differently through recovery. Modern life often separates pain from purpose. You sit under artificial light, monitor symptoms, search for explanations, and imagine every possible future. Attention circles the sensation until the alarm becomes the entire landscape. Your ancestors had fewer chances to isolate the feeling from everything else. Injury remained embedded in weather, movement, hunger, conversation, responsibility, and the immediate needs of the group. That could be brutal, but it could also prevent pain from becoming the only story the brain was hearing. Does that mean ancient life protected people from chronic pain? Certainly not. Healed fractures can remain painful. Osteoarthritis existed, teeth cracked, backs wore down, infections spread, childbirth injured bodies, and many people died from conditions that modern medicine treats routinely. Ancient humans were not superheroes, and suffering was not somehow more noble because it happened beside a campfire. The archaeological record is biased toward survivors. A healed bone tells you about the person who lived long enough to heal. It says little about the person who died quickly, left no recognizable injury, or was never preserved. That warning matters. So the real counterintuitive twist is not that ancient humans possessed a secret biological tolerance that modern bodies lost. Their advantage was a survival system built around pain. They expected discomfort to carry meaning. They adapted tasks instead of demanding an immediate return to normal. They used accumulated knowledge. Most importantly, they treated survival as a group project. Modern medicine gives you extraordinary advantages your ancestors never had. Anesthesia can silence agony. Antibiotics can stop infection. Imaging can reveal hidden damage. Surgery can rebuild a joint that once would have ended a life. You should not trade any of that away. But modern life can quietly remove some of the older supports. Pain may arrive while you are physically safe yet socially isolated. You may be surrounded by technology and still feel that the burden belongs entirely to you. You may interpret every sensation as a private failure rather than a problem that deserves adaptation and care. What would change if pain were treated as information instead of identity? You could protect what is injured without believing you are broken. You could accept help before reaching collapse. You could stay connected to purpose while healing, rather than waiting for perfect comfort before life is allowed to resume. That is the ancient lesson hidden inside scarred bone. Your ancestors survived pain not because it mattered less, but because the injured person still mattered to everyone else. You wake with a deep cut across your foot. And now the first thing you notice is not the absence of a hospital. It is the presence of the people who will help you reach sunset.